If children under the age of 18 are not allowed to drink alcohol, gamble, or buy pharmaceuticals that can be used as illegal substances, why should they be allowed to have permanent, life-changing surgery performed on them? People argue and petition to change and create new laws to protect their children, so they should protect their children from going under the knife as well. Children's safety and evaluation of mental health and science clearly dictate that plastic surgery should not be allowed on children under the age of 18. The risks are real and the evidence is substantial. The idea of children younger than 18 undergoing cosmetic surgery is a thoroughly debated topic. Something to consider is the reason children are getting these procedures, wanted versus peer pressured. It is important to understand the whys so that the relevance of having surgery can be examined. Another issue to ponder: what is safe and what is dangerous? Different procedures require different steps to be taken and can lead to different outcomes and/or complications. Many argue that the risks of plastic surgery are far too great for children, while others ignore the warning signs and ask to sign the consent forms. Even after the debate, the question still stands: plastic surgery for children, yes or no? No matter on which end of the debate a person resides, the subject of mental health must be analyzed. When contemplating plastic surgery on a child, the mental state and reasons behind having the procedure should be openly talked about between patient, parent, and doctor to determine the means behind the wanted procedures. Unfortunately, parents or guardians frequently pressure their children with their judgments to receive plastic surgery. Much of the fuel backing the motivation for adolescents to get these procedures is from a growing influence that social media has on new generations. Social media has sparked a trend of appearance-based bullying and hyper-awareness of their appearances. More often than not, minors want plastic surgery because of their body image issues influenced by others. And because of this, many doctors will abstain from operating on such patients. Doctors say that their money and time would be better served by obtaining mental health treatments to address self-esteem issues. Children should focus on having the mindset of being children. Parents are required, and should continue to be, to give informed consent, which makes perfect sense because not only are their capabilities of decision-making entirely evolved, but they have the capacity to understand the risks in their entirety. Lastly, the physiology of humans must be examined before any action is taken. Human anatomy was created to work in very specific ways and should not be compromised by operating at too young an age or preventing proper health checks. The FDA has not approved breast augmentation, the enlargement of breasts through surgery, among other surgeries, for the reason that children's bodies are not entirely developed. Many children have yet to obtain all changes from puberty, so the choices they make now may not present as they wished in 10 years. Plastic surgery on minors can also interfere with future health, particularly in future childbearing women. After undergoing breast augmentation, if a female chooses to have children, her hormones affect the growth of her breasts, but complications arise with that growth in later breastfeeding. Choosing to have plastic surgery against the way of the human body is extremely dangerous and should be avoided. In conclusion, mental health inspections keep people from making decisions for the wrong reasons, and science presents pure facts for not allowing children to undergo plastic surgery. No one, especially children, should feel pressured to permanently alter their body. Children most certainly should not have plastic surgery without knowing all the risks and possible complications. Children under the age of 18 should not have plastic surgery, and the community needs to understand that as well.